Welcome nursing and paramedic students. For the respiratory module, I just wanted to go over Pao2 to FiO2 ratios. I know some of you have a little confusion over that and what exactly it entails. So basically what we want to look at is how much oxygen we have to give a patient and how well that oxygen is diffusing across the alveoli and into the capillary circulation. Basically how well the patient's oxygenating. This is important because this can kind of guide our therapies. We use it a lot in the ICU setting where we try to determine is the patient in mild, moderate, or severe ARDS. So basically what we have is we just have a simple equation. We have Pao2 that we get off of a blood gas divided by our FiO2. And I know this is where some of it gets a little tricky for some of you. In that FiO2, how do we convert a percentage to FiO2? FiO2 is fraction of inspired oxygen. So what we want to do is convert all oxygen percentages into a fraction. So basically a simple way is if somebody's on a 40% face mask, we want to convert that to a percentage. So we can do that one of two ways. You can either divide it by 100 or we can just move the decimal point simply 2 places to the left. So that'd be 40.0, so we just go 1, 2. So a 40% face mask is an FiO2 of 0.4. Some things that you may want to know or you're curious about is like, okay, what about that patient that's on the nasal cannula on 1 or 2 or 3 or 4, whatever liters per minute? How does that factor into a percentage of oxygen? Well, there are some equations. Depending on where you look, it'll vary a little bit, but generally, as a general rule, we know room air is 21%. So 1 liter a minute is going to be 24% oxygen. And then, so we know room air is 21%. So for the first liter, it goes up by 3% of oxygen. Each subsequent increase of a liter per minute is going to go up by 4. So 3 liters will be 28%, or 2 liters will be 28%, 3 will be 32. 4 liters a minute is going to be 36. 5 liters a minute is going to be 40. 6 liters a minute is going to be roughly 44. These are going to be your percentages. Once again, so if we have somebody that's on the 5 liters a minute, we know that's 40%. Like I said before, we just move our decimal point 2 places to the left, so it's 40%. So why is this important? So as you've heard me say in lecture, a lot of times in healthcare we like to quantify bad. So especially our patient that's, say they came in with a really bad pneumonia, they're maybe over on the floor, they're doing a little worse, they're more tachypnic, they're a little more tachycardic, and now all of a sudden we increase their oxygen up to 5 liters a minute. The provider orders an ABG, and all of a sudden now let's say the ABG comes back at, we're going to say in this case, to make the math easy for me, the Pao2 comes back at 60. So what we look at Pao2 is we're looking at the partial pressure of oxygen in the arterial circulation. So we know our Pao2 is 60, we know our FiO2 is 40, so or 40% or 0.4, we divide that, that's going to equal 150. We know from our readings then, ARDS, and a lot of this comes from the ARDS net study that was done years ago. It's still very relevant, still used quite a bit. So we know from our readings that 200 to 300, if that is our Pao2 to FiO2 ratio, that's going to be called moderate. Oh, mild rather. Mild, moderate, severe. Hello. I should know that from pain medicines. It's just like pain medicines. Mild, ARDS, 100 to 200 is going to be moderate, and then less than 100 is going to be severe ARDS. So basically what it does is it allows us to quantify bad, so to speak. So this patient obviously that we did was 150, so they're moderate severe. let's say we bumped them up, or we kept them at 5 liters, we did an ABG in 2 hours later, and now all of a sudden their PaO2 is 40, and they're still on the 40%. We know that's going to equal 100, so now they've become worse, and they're now in the severe ARDS. Just a second, I'm going to clean my whiteboard off. Okay, so basically what we're looking at here with PaO2 to FiO2 ratio. So remember from our blood gases, there's only 2 ways that we can really improve oxygenation in theory. So here we have our little alveoli coming down, and then we have our capillary, which goes to every alveoli. There are basically 2 main ways that we can increase our PaO2 ratio. We can increase the amount of concentration of oxygen, so we put more oxygen molecules in there, a higher percentage. This would be going, let's say we went from 40 to 60%. This will increase, because we all know areas diffuse from an area of high concentration to an area of low concentration. So we set up a concentration gradient, and that's what we do when we increase our FiO2. The other way is that we can increase the PEEP or the CPAP. That is just basically constant pressure that we're going to put to drive the oxygen molecule into the circulation. So people that are on CPAP at home at night, if they have obstructive sleep apnea, that just holds a certain amount of pressure in these alveoli, and that helps drive the oxygen across the alveolar wall and into the capillary circulation. So basically, this is 2 ways that we increase oxygenation: pressure or concentration gradient. For you paramedics, you might think, well, we don't get ABGs, we're riding around in the back of a truck. That is very true. So a kind of a simple way that you can see how well your patient's PaO2 to FiO2 ratio is, we know roughly with normal temperature and normal blood pH, a PaO2 of 60 is going to equal an oxygen saturation of 90. Like I said, given normal temperature or normal pH. So if you have somebody that's had a bad lung injury, or maybe you went to the nursing home and you pick up a patient that's not breathing real well, you put them on a non-rebreather mask, which is approximately 100%, give or take, and then you hook them up to your sat monitor and you're maybe getting 89, 90, but you have a good waveform, they're not really satting pretty well. So what you can know from this is, so if their FiO2 is 100% on that non-rebreather, we know 100% like up here, so if we had 100, we just move the decimal point 2 places to the left, so that's going to give us an FiO2 of 1.0 on 100%. And we know that their sats are 90, so we know that equals a PaO2 of 60. So we put it in the equation, we put the PaO2 divided by the FiO2, so we get 60 divided by 1, and we know from our previous, that's going to equal 60, so we know they are in severe ARDS. One thing I forgot to mention when I looked at those numbers, if it's 100 or less than 100, it's severe. If it's 200 to 300, it's considered moderate. If it's 200 to 300, it's considered mild. Those are all contingent upon that the pressure, or that they have a PEEP or a CPAP of 5. So basically, we do this a lot in the ICU on ventilator patients. 5 centimeters of mercury, or 5 centimeters of water pressure. We don't get mercury anymore. I'm old. You'll be able to see some of this in my talking that I'm old. So that's the PEEP or the CPAP's what drives the oxygen in. So that's what's contingent upon. So if you do some reading, you might say, hey Larry, you forgot to mention that they require a PEEP or a CPAP of 5 to meet that ARDS protocol. Hopefully this will kind of help you visualize what we're talking about when we look at PaO2 to FiO2 ratios. It's a pretty simple test, or a pretty simple calculation you can do to kind of quantify how your patient is breathing. Thank you very much.